All righty. Hi, everybody. Thank you so much, and welcome to our next edition of our Public Health Power Hour with American Cancer Society. This is with their Population Science Department, and I'm really excited. They have my goodness, you all, they have about 18 people in the panel today. I don't know if everyone is going to speak to you all, but the person that we are going to connect with very first is our wonderful Ms. Mariah Landry. She is a part of the American Cancer Society, and I'm going to just go ahead and kick it off to her. If you all have questions, please put them in the chat. You all have the ability to take yourselves off of mute and ask questions as you see fit during the power hour. But of course, at the last about 10, 15 minutes of the presentation, there'll be an open opportunity for you to ask any questions that you should have. All right. With that being said, I am going to kick it off to Mariah. Thank you so much, Mariah and team, for being here.
Oh, thank you so much, Evely. Greetings, everyone. I am Mariah. For today's Public Health Power Hour, I'm here with a group of teammates to share with you a little bit about the American Cancer Society's Population Science Department, what our work is all about, and what it's like to work here. In case you're unfamiliar with us, I will offer an introduction to American Cancer Society, also known by the acronym ACS, which we will use throughout the talk. We are a large, well-established nonprofit organization founded in 1913 by 10 doctors and 5 lay people in New York City. The ACS overall vision is to end cancer as we know it for everyone, and our mission is to improve the lives of people with cancer and their families through advocacy, research, and patient support to ensure everyone has an opportunity to prevent, detect, treat, and survive cancer. Our teammates featured today work primarily towards the research end of the mission. As we all know, cancer is an ongoing burden here in the US. There are over 2 million new cases a year and 600,000 deaths. The cancer type most commonly experienced by men is prostate, and by women is breast. And the type of cancer with the highest mortality remains lung and bronchus in both men and women, followed by prostate and breast, respectively. At the ACS, our work is divided amongst 3 pillars: discovery, advocacy, and patient support. Our work with population science is housed within the discovery pillar. Apart from the intramural work that we will describe here further today, Discovery also funds extramural research. In fact, we are the largest private nonprofit funder of cancer research in the US. ACS channels advocacy work through our nonpartisan advocacy affiliate, the ACS Cancer Advocacy Network, also known as ACS CAN. Their staff work with both professionals and volunteers to influence legislative and regulatory solutions that fight cancer. The patient support pillar has various long-standing programs, including the Road to Recovery, which breaks down transportation barriers for cancer patients, the Hope Lodge, which provides overnight accommodation during cancer treatment, along with our All About Cancer 24/7 technical helpline, the ACS Cares Community Resource app, and the Cancer Survivors Social Network. Our pillar of the organization, the discovery pillar, is further divided into 2 groups, one team being our team, the population science team, and our sister team being surveillance and health equity science. Surveillance is a leader in reporting on cancer descriptive statistics. Their primary publication is Cancer Facts and Figures, which is published yearly, and this is a high-impact, frequently cited publication. If you're interested to learn more about the work of our sister team, Surveillance, you can see the link in the slide, and we will share these slides after the talk, and it's being recorded. To elaborate on the nature of our work, we administrate, facilitate, and conduct research on the ACS's longitudinal prospective cohort studies. In fact, we are international leaders in the prospective cohort study design, having been instrumental in developing this study type in the 1950s. In case you're unfamiliar with this study type, a prospective cohort aims to enroll as many participants as possible and collect data on these participants for as long as possible, in our case, 30 to 40 years. This study design is excellent for learning more about the effects of various exposures over long periods of time, which cannot be well ascertained from clinical trials or case control studies. They are also excellent for better understanding the risk factors of rare diseases. Conducting this type of study is an enormous undertaking requiring a consistent and relatively large workforce. Thus, we are a group of approximately 70 employees, many of our senior staff having spent most of their careers supporting these long-term cohorts. So now I will bridge into sharing some of our accomplishments over the years. For over 70 years, we have conducted some of the world's largest prospective cohort studies, which have contributed substantially to help understand risk factors for cancer. Our first study was the Hammond and Horn study, which led to the confirmation of the link between smoking and lung cancer in 1954. This discovery ultimately led to a 50% decrease in smoking. Next, we ran the CPS-1 cohort, which followed 1 million participants for 12 years, followed by the CPS-2 cohort, which followed 1.2 million participants for 40 years, followed by the CPS-3 cohort, which follow-up continues on over 300,000 participants. And I will hand off to my teammate Sadaf.
Hi, everyone. So our CPS cohorts are valuable to research for their large size, longevity, and racial and ethnic and geographic diversity. An advantage of having large cohorts is that we can study rarer types of cancers, which may be harder for smaller cohorts because they might not have enough data available. Long-term follow-up with our participants also gives us diverse data on factors that may be associated with a cancer diagnosis. Our CPS-3 cohort is also one of the largest racially, ethnically, and geographically diverse cohorts for cancer studies. And we have participants enrolled from all regions of the United States and Puerto Rico, and this can kind of be seen on the map that's shown on this slide in the upper right. So the darker the area, the more participants we have.
Hi everyone, I'm Jillian, and I'll be providing more details on our follow-up activities for Cancer Prevention Study 3. So survey data, blood samples, and waste measurements were collected at baseline for enrollment, which began in 2006. Follow-up with our participants has included triennial surveys, state cancer registry linkages, and several sub-studies. And now I'll quickly go over the timeline of these efforts. In 2015, 2018, 2021, and 2024, we have followed up with participants who self-reported a breast, blood, ovarian, or colorectal cancer on a triennial survey to collect and abstract medical records to ultimately request tumor tissue from pathology facilities. From 2019 to 2023, 20,000 CPS-3 participants participated in the accelerometry sub-study, where we collected physical activity data using actigraph devices for 7 consecutive days. In 2020, we implemented an online portal for our participants to complete their triennial follow-up digitally, and we have since offered these participants additional surveys. We also released a COVID-19 app in 2020 to track symptoms and testing. From 2021 to 2023, 10,000 CPS-3 participants agreed to provide saliva and stool samples for gut and oral microbiome research. From 2022 to 2023, 400 CPS-3 cancer survivors participated in the HEALED sub-study, which was a physical activity intervention that took place over 1 year, with physical activity data collection occurring at 4 time points. And currently in 2024 and 2025, we are aiming to collect a second blood sample from at least 10,000 of our CPS-3 participants. Thank you.
Thanks, Jillian.
Hi everyone, my name is Eunice, and I'm going to be providing a little bit more information about our newest population cohort study called Voices of Black Women. Collectively, Black individuals have had the highest death rate and shortest survival of any other racial group across the US for most cancers. So to build upon that 70-year legacy of population cohort studies that ACS has done, we decided to turn the lens specifically to Black women for our newest cohort study. Voices of Black Women will be the largest ever population cohort study, recruiting 100,000 participants to better understand the cancer risks and outcomes among Black women. And we are aiming to gain findings that help inform strategies to improve cancer prevention, treatment, and survivorship in this population. Next slide. So currently, we are recruiting for the study. We've recruited just over 3,000 participants thus far. And for the study, we are looking to recruit Black women who are between the ages of 25 and 55 years old, who have no history of cancer diagnosis, except for basal or squamous skin cancer, and who live in the United States or Washington, D.C. For our participants who enroll, they will complete an entirely online and self-paced life and health history survey that asks questions about their family history, about some of their behavior and lifestyle, and then also some questions that are unique to this population, such as experiences with racism and discrimination, experiences with generational wealth and social standing, social circles and support, as these are also factors that influence an individual's health. And then after completing that initial life and health history survey, we will follow up with our participants twice a year with some additional surveys that are much shorter, about 30 minutes each. And then we will also provide invitations for our participants to provide additional optional data in some sub-studies over time. If you're interested in learning a little bit more about Voices of Black Women, or even joining yourself if you're eligible, you can visit voices.cancer.org or scan that QR code really quick to learn more and join today. Thank you.
Next, I just wanted to highlight a few of our research contributions to cancer prevention. Our studies have led to landmark contributions in understanding smoking and cancer, including providing the risk estimates for every Surgeon General's report on tobacco and health since the first in 1964. We have made significant contributions on air pollution and health, leading to changes in EPA regulations. We have made significant contributions on the role of postmenopausal hormone use and gynecologic cancers in women. And we have made significant contributions to understanding physical activity, sedentary time, and its relationship with various cancers, among many other things. I just highlighted a couple points there. After explaining some of our overall research accomplishments and mission and what our cohorts are all about, now I wanted to transition this talk into speaking in more practical terms about what our jobs are like and what we do on a day-to-day basis, so that you might have that information to imagine what it might be like for you to work here if you are ever interested in joining us. And also we'll speak a little bit to the paths that each of our teammates followed to get here. Today, we will describe the work of 8 of our teams within population science, program management, data analysis, the portal team, communications, biospecimen management, study management, and the academic path. First up, program management.
Hi, everyone. Thanks for having us. My name is Mahara Sohail, and I'm here with my colleague Eunice. And together we are representing the program management team at ACS. Our team is a group of 5 members. We are 4 managers and 1 coordinator with different projects that support the program. A little bit about me. My undergraduate background was in biology, and I joined ACS in 2023 as a project manager. Some things about what we do as a team. We oversee and coordinate various projects related to ACS's population science research, which includes ACS's collaboration with Emory University's Winship Cancer Institute, which is the bulk of my work, and regulatory activities such as IRB management related to ACS's cancer prevention studies and Voices of Black Women. And now I'll hand it over to Eunice to cover the rest of our team details.
Thank you, Mahira. Hi again, everyone. My name is Eunice, and I'm the Community-Based Research Engagement Manager on the project management team. My background is in biology, and I also received a Master's of Public Health. And I started at ACS back in 2023. And a little bit more about our team is that we also manage community outreach and recruitment for the Voices of Black Women study. So working with team members and also external entities to promote the study. And we also engage in volunteer and partnership coordination in service of recruiting participants for Voices. Overall, our team engages in task management and developing workflows to continue keeping processes moving within our department. We also document activities and evaluate the outcomes of various department projects. Thank you.
Thanks, Eunice. I'm going to present for my teammate, Emma Massesson of the communications team, who cannot make it today. Emma works in a group of 3 assistant scientists and 1 scientist, each with various backgrounds and training. Her team is responsible for answering questions and maintaining study data for over 300,000 CPS3 participants and our Voices of Black Women participants. Their team addresses all inquiries that we receive from participants via phone or email. They also create content for all outbound communications to participants, which includes e-newsletters, newsletters, and email templates. Their team also conducts data cleanup and quality control checks on all of our contact information for patients. This requires using SAS programs. They also resolve CPS3 undeliverable surveys. Emma has a background in biology. She worked as a lab tech for 2 years prior to starting at ACS in 2022. And she is currently pursuing her MPH at GSU, so some of you may know her. Next slide.
Hi, good afternoon, everyone. I'm Danelle. I am the newer associate scientist at ACS, and I'll be talking about what we do in our neck of the woods, survey design and data collection. So we consist of a team of 4 scientists. 2 of them are with us, Geneviette and Tayana, and we're trained in qualitative and quantitative analyses. So what we do is we assist in the development of surveys and sub-studies, as well as communicate with participants via phone and email, as well as manage participant information and participant engagement. We also process and clean raw survey data, both in the qualitative and quantitative space. And we also create and update and manage analytic data sets. A little bit more about myself. I did get my bachelor's in psychology, but during that time, I also did work in maternal and child health and cancer epidemiology, and went straight to grad school for my master's of public health in epidemiology. Take it over, Geneviette.
Hi, I am Geneviette. I am a senior associate scientist, and I've been at ACS since 2007, so a long time. Public health is actually my second career. I got a BA in psychology, and I also did a training program to become a certified elementary school teacher. So I actually taught elementary school for 3 years in New York City before deciding to move south to Atlanta and get my MPH in health education. I've been working at ACS again since 2007, started out doing tobacco research, and now I am the qualitative lead primarily for our Voices study.
Hi, my name is Tayana Smith. I currently work as an associate scientist, been at ACS since 2021. And I originally started with a bachelor's in chemistry with a minor in anthropology. I originally wanted to go into the medical field, but realized that was not for me. So I pursued what I liked about anthropology and went into my MPH and worked for health policy and management. And now I'm currently doing my doctorate at Mercer for social epidemiology. continuing my love for cancer research while also studying maternal and child health with Black women.
Cool. Thank you, Tayana.
Hi, everyone. My name is Maria. I work as an assistant scientist on the Portal team. The Portal team primarily oversees the development and management of our online participant portal, which is where CPS3 participants can opt in to complete surveys and sub-studies, and Voices participants complete all of their study activities on the portal. This work began in 2020 when we launched the portal to a small group of pilot participants, but has evolved over the past 5 years. On the portal development side of our work, we work with our vendor who develops the platform to make the portal more user-friendly for us and our participants through portal enhancements and generate content. We also perform outreach to enhance participant engagement and retention. On the management data collection side of our work, we build and test surveys, clean survey data after the survey closes, and we implement other miscellaneous initiatives on the portal platform, such as sub-studies. We are made up of 2 assistant scientists and 2 associate scientists. A little bit about my background. I got my bachelor's of science in biology and my minored in public health. I worked for a year in a lab and then came to ACS in 2022. And now I am a first-year MPH student at GSU, concentrating in epidemiology.
And you've already heard from me. I'm Mariah, but this is the team that I currently work on. I'm an associate scientist, but my background is actually in nursing. I graduated nursing school in 2013 and worked as a nurse through 2021 while I was pursuing my master's in public health at Emory. And then I landed a position here at ACS in the fall of 2021 on a different team, on the data analysis team, and transitioned to this team in this past fall in 2024. My primary work supports team operations as an R programmer.
Hi everyone. My name is Jaimin. I'm an assistant scientist on the Portal team. I have my bachelor's of science in psychology. And before ACS, I worked as a lab research assistant at different institutions such as GSU and Emory. And I joined ACS in the Portal team in August of last year.
Thanks, Jaimin.
Hi, everyone. Again, I'm Jillian, and I'm representing the Outcomes and Operations team. We are a team of 8 scientists with various backgrounds, but my track to this position has been a BS in biology in 2019 and an MPH in epidemiology in 2022, and I've worked here since. So the Outcomes and Operations team is part of the Study and Biospecimens Management Group, and our main areas of focus are state cancer registry linkages, where we collect oncologic data associated with our participants from 37 state cancer registries, national death index linkages, which inform mortality data on our participants, acquisition of medical records, which are used to curate oncologic data in-house and request tumor tissue from pathology facilities, participant communication for sub-studies, which ensures understanding of our survey materials and processes and ensures that samples and data are collected correctly when our participants have questions, and sub-study operations, which includes sending out and processing our sub-study kits, which is a huge effort considering tens of thousands of kits are sent out for some of these sub-studies. And one example of this is the accelerometry kit, which included a paper survey, which needed to be digitized when we received it back, and an actigraph device, which needed to be downloaded and processed. Thank you.
Thanks, Jillian.
Hi again. My name is Sadaf, and I'm one of the 2 people here representing the biospecimen team here. So we are a team of 8 scientists with various backgrounds and education. So I can talk a little bit about my track. So I got my bachelor's in biology, and then I did my MPH with an epi concentration at Emory. after that, since I graduated my MPH in 2020, and COVID was the forefront of that, I did an epidemiology fellowship through Emory working on COVID response with local public health here in Georgia. After that, I started here at ACS as an associate scientist one back in 2023. So a part of what we do is we collect high quality samples from all of our study participants. So for example, we are currently collecting blood for both our CPS3 repeat blood sub-study and for the Voices study mentioned earlier. And this involves managing the process of participants scheduling and completing their appointment with our study partner LabCorp, making sure that the samples and associated data get to our biorepository and are processed in a timely manner, and troubleshooting any issues that come up during this process. And I'll give it to Holly, who is my other colleague on the call.
Hi, everyone. My name's Holly Vins, and I am a scientist in the Biospecimen Management Group. I got my bachelor's at Arizona State in Justice Studies and Global Health, and then moved to Emory for my MPH in Global Environmental Health. And I worked at CDC for about 4 years before transitioning to ACS in 2019, so right before COVID hit. So pretty good timing on my part. What we work on, I work with Sadaf on the blood collection, and then we also make sure that all of these samples that we have are stored appropriately. We have all of our frozen samples stored off-site at a biorepository in Norcross, Georgia. So that's our blood, saliva, and stool samples. And then we actually store our tissue samples on site, and we have 2 staff members who are in charge of making sure all of the data and the tissue and all of that is accurate and kept safe. And then we also facilitate the use of these samples. So we do a lot of collaborations. Most of our work with our biospecimens are with collaborators at Emory, at other academic institutions, with the government, other cancer research centers. So it's a big range of use of these samples, but a lot of really interesting research has come out of it.
Thanks, Holly. So I'm up next again. I'm going to describe the work of my former team, the data analysis group. This group consists of 12 MPH trained analysts. We work with PhD level principal investigators to facilitate scientific projects. To start in the position, one needs a basic competency in R or SAS, but coding skills develop further while in the position. Master's level epi and biostatistics coursework is highly useful in understanding the study design and the kind of organization you're doing to prepare the data for modeling. We write code to create data sets for an investigation, and this can be extensive, sometimes 10,000 or more lines of code for one project. We also write code to produce tables, figures, and models for the project. And analysts are included as authors on the papers they work on as the primary analyst. And another substantial use of our time goes into reviewing the code of other analysts who do similar projects. So I've already introduced myself, but I started in this team in 2021, but I'm now on the portal team, which is just a nice little example of when you start with an employer, you may find yourself joining another team along the way. I didn't see this change coming for myself. But around the 3 years that I worked for this group, I was a primary analyst on 6 scientific projects. And while working for the team, my skill set as an R programmer developed substantially, and I reinforced concepts in epi and biostatistics that I was introduced to while studying for my master's. And this position was a career transition for me. I had spent 8 years working as an RN in hospitals across the US, in Virginia, California, and New York City, and at Emory Healthcare in various ICUs. And while I was studying for my MPH, I kind of didn't know about the data analysis component of public health, truthfully, before starting in the degree, but I found myself gravitating towards it and kind of landed in this line of work, which I wouldn't have necessarily seen for myself 5 years prior. Now moving on to Kelly's.
All right. Hi. Yes, I'm Kelly Kara, and I'm here representing the academic track. We currently host 7 postdoctoral fellows at ACS, and this is essentially a research training position that's available to applicants with new or recently completed PhDs. So if you're in the bachelor's or master's program right now, you may be wondering, why would I even consider pursuing a PhD? Maybe you're kind of sick of school already. The idea really is that having the PhD can open up new opportunities to become a principal investigator of your own research projects and or to lead funding or applications for funding that would allow you to carry out those research projects. So as a PhD, you're going to be developing your own research questions and your own program of research, which is like thinking in the long term, multiple studies that might follow a line of questioning. You can come up with your own study ideas. You get to be very intricately involved in designing the study. You may be working with collaborators, but you could lead a project. You would be coming up with a data collection plan, potentially developing an analysis plan alongside an analyst, or you may be doing the analysis yourself. Conducting the research and then generating manuscripts is also part of being a principal investigator. Having a PhD is also a requirement for certain job opportunities. So if you're interested in becoming an associate, full, or tenure track professor, for instance, most universities are going to require that you have a PhD in a related field. If you want to be able to become a director or a senior level leader in an organization where you may be overseeing other researchers or an entire department, you're generally going to need to have a PhD. It's credibility, it's clout, and it's training that is understood. If you've gone through the PhD process, you have the adequate training to fill those positions. So you may not be familiar with what postdoctoral fellowships are or postdoctoral research positions are. Again, this is considered a training position. Usually they range from 6 months to 2 years following the PhD, but I've seen fellowships as long as 4, maybe even 5 years. That's kind of uncommon. The goal with a postdoctoral fellowship is really to become an independent researcher and a collaborative researcher. So you're going to be increasing your research experience after you get your PhD, where, believe it or not, you may have only completed like 3 research projects over the 4 to 6 years of your doctoral training. So having this postdoctoral fellowship gives you that extra experience. It can make you stand out when you're applying for faculty or new PI positions. And actually nowadays it's generally expected, depending on your field, and it may be necessary to secure a job following your PhD, which, that may be disheartening, but it's really a great opportunity to also refine your own personal interests. So here at ACS, as I mentioned, we have currently 7 fellows. Our positions last somewhere between 2 and 3 years. And the research backgrounds and interests of our postdocs vary widely. So you can see here, I have a background in English. This was before I really knew what I wanted to do with my career, but that English background has really helped strengthen my ability to write. Eventually, I decided I did want to become a researcher, and I was interested in well-being topics. So I was working in the field of psychology. My interest in psychological well-being eventually transitioned into physical well-being, where I finally landed in a PhD program in the field of nutrition, epidemiology, and data science. And so my current research interests are focused on the effects of plant-based and healthy dietary patterns on various health outcomes, including cancer. And here at ACS, I get to work with our great data that were collected from the CPS2 cohort members that Sadaf described earlier. So I hope that gives you a sense of where you might think about going after finishing your degree.
Thanks, Kelly. Next slide. Okay.
Okay, so we've given you a bit of background on our organization and what we do in our department. May have been quite a bit of information to digest, but right now we're going to switch gears and provide you with some tips that will help prepare you for similar types of positions. Hard skills are not everything, but they will help you in a competitive job market. All right, so some of the skills that we have even mentioned in our talk that we know would be beneficial to develop as you are a student or even after you graduate, of course, are data analysis skills. Any programming language helps. And here we've listed a few of the programs that we even use in our day-to-day work here at ACS. And keep in mind that when you are thinking of garnering data analysis skills, that they can also be transferable to other industries. Public speaking and scientific communication. Those are really great skills to hone. It's enough, I mean, we want to conduct research, it's vital to what we do, but keep in mind that that knowledge needs to be disseminated, and we disseminate that knowledge through presentations and published works. So honing your public speaking and written communication skills will definitely be an asset and something that people look for when you're applying for positions. Having coursework such as epidemiology and statistical coursework is really good to have under your belt because it will open up more analytic opportunities and it provides you with more experience in those areas. It's also recommended that you gain non-coding or have experience with non-coding data tools such as Excel, Power BI, map making programs, of course, the Microsoft Office suite of programs. Those are used in a variety of ways when you're working. And so having facility with those data tools is definitely necessary. Grant writing. We can't do what we do without funding, right? So luckily here with ACS, we're a nonprofit, so our research is mostly funded through donor dollars. But that's not the usual case. And a lot of organizations and universities, you need to write grants in order to gain funds to conduct your research. So if you can gain experience while you're in school working with a professor who's writing a grant, even if you can just view the grant or sit in on some of the meetings on how they go through the grant writing process, that would definitely be a really good skill that could be useful down the line. Program evaluation is another skill that we recommend that you get some experience in. You conduct the research, you disseminate it, you implement it, but how do you really know that it's working without some type of evaluation? Evaluation will also help you with any future research because then you'll be able to look back and see, well, what worked, what didn't work. So program evaluation is a big part of what we do as well in research. And just to reflect a little bit on our experiences moving from being students to graduating, and then now we're in the workforce. We just want to highlight that you shouldn't shy away from technical coursework, okay? Sometimes there may be classes that you want to take that can't quite fit into your schedule, or you have other required courses that, of course, take precedence. So think about maybe even auditing a class or taking a class as pass-fail so that you can still gain the information without having to worry about fulfilling the requirements of the course, right? Or having to take a hit to your GPA because you weren't really able to devote the time needed for all the necessary pieces of the course, but you can still sit there and soak up that information. Try to find a balance between, again, the subject matter coursework and experiences that will boost your career, like what you need to do for your career. Things such as writing a thesis or participating in an APE can also provide experiences that can develop a skill set that you may want to continue in your professional career. Other ways that you can enhance your technical skills is by using cost-effective training platforms such as DataCamp. That's a wonderful tool. I've also used Coursera. There are other platforms such as LinkedIn Learning that will teach you some of these skills that maybe you didn't pick up in your formal training, but you can learn these things on your own. A lot of times they're self-paced, and you can just go along as what works for you. You know, go with what works for you, and you can develop some other skills outside of what you learn in school. Think about how you can leverage past experiences and stay open-minded, all right? Make sure that you attend networking events. A lot of times there are positions that you can hear of through networking. There's a lot of things that you can gain when you meet other people. Put yourself out there. Don't be afraid to talk yourself up and to meet people. You never know what opportunities that could lead to. You also want to cast a wide net when you're applying. You don't, there are a lot of positions out there, especially with what we do in public health, that the skills that you're gaining now in your program can lead to all sorts of positions. That's one thing that I always loved about public health, that it is so varied. There's so many things that you can do within public health and still be within the same field. So think about that as you're looking for jobs, what might be interesting to you. And you also want to set realistic goals for yourself. Think about how you can present quality applications. You want to make sure that you have the time to devote instead of just applying to a plethora of positions because, you know, you're thinking, oh, I need to get a job. You really want to take the time to present quality applications for the job that you really want. And of course, as you saw, many of us are going back to school. You could also think about how you might want to continue your education and what your next steps are past this degree that may open even more doors for you.
Thank you, Genevieve. I'm going to come back to questions, one more slide. But if you are interested in ever working with us, do check our job board. You may also be interested to follow us on LinkedIn as individuals or as an organization. I have also personally sent previous job posts to Evely at GSU Career Services. News today, we actually just had a job post, so I will send that job post to Evely. Opportunities at ACS open on sort of a rolling basis throughout the year as team members leave or retire, and periodically new jobs are also created. We will also be having some paid 8-week master's and undergrad summer internships also posted on a rolling basis, so keep an eye out on the website for those. And just a tip, job posts on our website are generally up for 2 to 3 weeks. So if you are actively searching, check weekly. And once you see a post, kind of start working on the application so you can try to get it submitted in the first half of that 3-week time period that it might be up. After a job post is removed, unfortunately, you cannot apply. So that is all. I just wanted to open up for questions.
There was one early on. I don't know if Ishan is still on, but they asked, how has cancer research been affected by current executive orders and budget cuts?
That is a great question. I'm not sure if anyone else on the call might be more prepared to handle that question than myself, but we at ACS are extremely fortunate and well positioned for kind of changes in government priorities because we don't get most of our funding from the federal government. We do get some of it from the federal government, but not all of it. Most of it
less than 1%.
Yeah.
Yeah.
Most of it comes from our donors. So we're actually one of the strongest public health organizations in terms of being resilient to changing government priorities. But please do add to that if anyone else has a better answer than me.
I think that was a really good answer. I think that's what a lot of people have been wanting to know, just in our particular climate. That's the biggest question that I've been getting from students. Okay, so Abira has asked, is there a preferable software that is used at ACS? R or SAS?
I'll chime in on that, but same thing. Anyone else, please feel free to chime in. We use both. Some teams kind of have more history in one program versus the other. Just sort of by circumstance, our study manager group has a little bit more history in SAS, and our data analysis group is moving a little bit more and more towards R, but we hire individuals that preference either R or SAS. I personally am an R user, so I like R, but if you are interested in working for us, either language is highly useful.
Yeah, and I actually know right now a lot of the analyst team is spending time translating like historical programs between R and SAS. So actually having both is very useful, but either one, I know like the biospecimen group primarily uses SAS. So it just kind of depends which group you're with.
But we generally, if someone prefers a different language, that's not kind of marked against them in terms of hiring. I came to my team as the one of the primary R users when most of my colleagues were using SAS. So I was worried that that would be a problem, but I was welcomed as an R user.
Are there any more questions? I think those were some really good questions so far.
If we don't have any more questions, I'm just going to hover on our last kind of slide ending on optimism.
We do have one more. Ishan asked, were those programming languages difficult to learn?
I will chime in on that question. I really like to tell this story to students, but before I started my master's in public health, wow, oh wow, I was never on the computer. I never used Excel really. I never saw myself as someone that would be an analyst or writing code. I didn't know what R or SAS were before I started my master's. But I thought it was interesting and I saw the practical value in that skill set as a student. So I sort of tried to learn it. So I am the first to advocate that anyone can learn these languages if they have the time and the interest in learning them. It's like learning a human language the way I see it. But it is not a human language, it's a computer language for organizing data. But I definitely think that anyone can do it.
Can I add something? As someone who's been in a variety of fields, when I was in psychology, a lot of people in the social sciences utilize SPSS as a programming tool. So that's what I learned in my master's program. Then when I transitioned to nutritional epi, I was learning R at the same time I was learning SAS, because SAS is used for a lot of governmental data. So we have something called NHANES. I'm not going to remember the acronym well, but this is our national survey that looks at health and nutrition in Americans. And so all of those data are available for researchers to utilize, but they come in SAS files. So a lot of people working with federal data or national level data will be using SAS. But then I took some public health classes and I had to use Stata. So this is an entirely different programming language. So for me, the biggest challenge was trying to learn multiple languages at once. And like Mariah said, it's kind of like trying to learn French, Spanish, and German all at the same time. Like, you know, it would just be confusing. But now that I've been at ACS, I hadn't used R very much, but my background in Stata and SPSS and SAS really helped me quickly learn R. So the more languages you know, to me, the easier it is to adopt new languages. And so hopefully that's encouraging to you if you have some experience with another language. it will hopefully be easier to learn the languages you need here. And in the postdoctoral fellowship, I was given time to develop my R training skills, and now I'm using it every single day, and it's quite easy. I've only been here 9 months. So yeah, I hope that's encouraging.
Yeah. One other tip. So we at ACS, we use DataCamp. We pay for our employees to be able to use that service. I love DataCamp in terms of working on new programming skills that I don't already have. I think it's really user-friendly and pretty pain-free. So that's a tool that I would really strongly recommend for anyone interested in growing and as a programmer.
I also kind of want to emphasize the importance of how, like, everything is hard until it becomes easy, you know? Learning a new programming language is difficult no matter which one you choose. It's just something that you need to practice, and then one day it'll just not just click, but like it'll become easier. Things will start making sense. So if at the beginning, like for me, I think learning SAS at the beginning was very like discouraging at the beginning of my MPH, but the more you kind of just focus on it and work with more and more data sets, the more sense it becomes. So if things look crazy and like it doesn't feel like it's making sense, don't freak out, don't give up. Just keep looking at it, keep doing it, keep practicing it. And even once you graduate school, you think you know it, you start a job wherever you are, and then you work with real data, that's going to be completely different than whatever data you've been practicing with in school. So just keep an open mind. You will continue to learn even as you practice and work. I'm still learning new things about SAS and R. Yeah, so just don't be discouraged if things don't make sense. Just keep at it, keep practicing. And yeah.
We've got one last question before you move on. Saraha asks, what are the most in-demand roles at ACS for someone with a master's in public health?
That's a good question. I think I don't have a clear answer for that one, but for us, job posts become available kind of on a singular basis. So it just sort of depends on where an opportunity arises. Recently, we've had more kind of management type of jobs, administrative type of posts, and that's what our new job post that came up today was in. But that just changes throughout the year and this kind of depends on the circumstance in the post.
Right now, a lot of our work is in recruitment of Voices of Black Women. That's the post that just got posted. But yeah, there's a range of data analysis, but it just kind of depends what our current project is.
I think that is good to know. And there are no more questions at this time, so you all can feel free to move to your next slide.
Okay. Well, if any of you do have questions after the talk, we can share some of our contact information with Evely afterwards and with these slides, and you can feel free to reach out. But this is our last slide, just ending on an optimistic note of 110 years of wins against cancer, which means increased survival rates. In the United States, breast cancer survivorship is up to 91%, which is an increase from 75% in 1975. Colorectal cancer survivorship is up to 65%, up from 50% in 1975. And lung and bronchus cancer survival is up to 23%, which is up from 12% in 1975. And prostate cancer survivorship is up to 97%, which is up from 88% in 1975. I really liked that graphic. I thought that was a nice thing to share.
Oh, that's awesome. I love that. Well, thank you all so much for this amazing presentation. I think a lot of people got some great information in the chat. Everybody's saying it's informative. So I am really happy that we had the opportunity, and I look forward to the job opportunities that you're going to sit after this. So this is awesome. I don't have any additional questions. Does anyone have any additional questions before these ladies leave? No, it says thank you. It was very clear. Awesome. All right. With that being said, thank you all so much for joining this Public Health Power Hour. This has just been an amazing bit of information, especially given the times that we're in. It's really great to hear some wins and also just routes on how you could better prepare yourself for the industry that we're now in. So thank you all so much. Thank you to American Cancer Society. Thank you all, Mariah and team, all of you all. My gosh, it was like 19 of you on the call. So thank you all so much and have a beautiful rest of your day.
Thanks, guys. Thanks for joining.
Yes, thank you.
Thank you.